We are the buttress force in case that FEMA or HHS calls upon us to deploy medical professionals across the country to meet crises. We plan for that every day. We are gaming out emergency preparedness scenarios, and we stand ready when the President needs us to expand our mission.
The Department of Veterans Affairs and its medical professionals are prepared and activated in all kinds of emergencies, and the COVID-19 crisis looks like it may yet be another example of that. VA hospitals are not just reserved for veterans in these scenarios, and they do generally have extra beds available that can help if there is a spike in incoming patients. Veterans Affairs Secretary Robert Wilkie joins us to talk about that and more about how the department is getting ready. Mr. Secretary, welcome back to Fox News at Night.
Thank you, Shannon. Thank you for having me.
I got to tell you, we've talked about, I have a family member who's been in VA care. I did not know that there are times in which you would take in civilians and handle other emergencies under your umbrella.
Well, the first emergency mission that we have, Shannon, is to prepare to help the country in times of war and times of national pandemics like this. And so what we have is something that is similar to the reserves in the armed forces. We have a reserve component within the VA family of about 3,000 doctors, nurses, engineers who deploy in times of crisis. They are at the call of the President, call of FEMA in this case, and we go where we are needed. In terms of our facilities, our mission is, again, to help the country when we have space that is not being occupied by veterans. So we are looking at the number of beds that we have that are empty. We are constantly examining where our facilities stand. There's some facilities that are very crowded, and there are others that aren't. But again, our first priority when it comes to the beds is veterans, and then we look at the needs of the states and localities.
And what about issues of staffing? I mean, RevealNews.org has a piece that says data published by the agency in February shows the VA is short 44,000 healthcare professionals, including 2,700 doctors, 11,300 nurses and nursing assistants. The VA is beset by, quote, large staffing shortages, including physicians and registered nurses, according to a September report from the GAO. Please address that with, in light of everything else that may be coming.
Yes. Well, I think the GAO report is silly. First of all, we submitted the largest budget in the history of our department last year, calling for 400,000 employees. Well, we had 393,000, and we carried out the largest number of appointments in the history of our department, 60 million. Where we do have shortages is where the rest of the country has shortages, particularly in mental health and subspecialties in areas like cancer and primary care. So that's where our shortages are. But in terms of the delivery of our services, we have never delivered as much, and we have never delivered as varied services as we have just in the last few years. And I owe a lot of that to the attention that the President of the United States has given to veterans. I've said often that no campaigner in the history of presidential elections has ever made veterans the centerpiece of his campaign, and he carried out that promise when he entered the White House.
And he's busy talking with a lot of governors as they look at all kinds of options, from the National Guard to getting materials from DOD caches. I want to play something from Governor John Bel Edwards down in Louisiana and a request that he may make.
Right.
I'm asking for help in terms of surging our medical capacity here in Louisiana. We've got some requests in. For example, we have a VA hospital in New Orleans where we've requested to be able to surge patients there. We haven't received the response yet.
So he references a VA hospital in New Orleans. How does that decision get made? Does it go through the administration, through you specifically, or someone else?
Well, the way the national emergency works, that those requests have to go through in detailed form to FEMA and HHS. But I had a long conversation with the governor of Louisiana today. That's the hometown of my parents, New Orleans. And our hospital in New Orleans has precisely 28 empty beds. Now, we are preparing those beds for the influx of veterans in New Orleans who now have the virus. New Orleans is the largest cache of veterans who have the virus in the country. Much higher than Seattle, much higher than New York. So our priority first is our veterans, and then we will reassess to see when requests come in if we can help the states and localities. The president's instructions to me were that the first line of defense is local engagement, then state management and federal support. So that's the hierarchy we use.
Yeah, and we're going to talk about that a little bit later, how all those things work together and prioritize. In the meantime, Mr. Secretary, thank you again for visiting, and we just wish you all the best as you try to ramp up and be a part of this very important fight for the U.S. Thank you, sir.
Well, thank you. Thank you, Shannon.